There's a lot of conversation that happens when you're at your local dentist when it comes to not only dental hygiene, whether you need implants, crowns. Where does it all start? Well, of course, we send you to our specialist, Dr. Mark King, who specialises in periodontal work over here in Georgetown. Welcome to the show, my friend.
Thank you for having me.
Okay, let's just start with the history of your business. You opened 6 years ago.
That's right.
How does that feel? 6 years is huge in a small business.
Well, we're lucky to be where we are and lucky to have been here for 6 years and look forward to the remaining.
There are more, of course.
Hopefully.
Now, when it comes to seeing those patients, dental work is extremely difficult and very draining on the physicians. What's one of the most rewarding parts for you?
When you see someone that's kind of transformed their life or how they feel about themselves from where they began to where they end up, and it can be a big change, you know, for each individual.
It's transforming.
Right.
And also, I have to say, age-defying, because it can just reverse the look of someone like no tomorrow.
Oh, exactly. You know, it's not everyone has to be missing all their teeth, you know. You can have a Hollywood smile. Exactly.
We love that, everyone. All right. What actually is a periodontist to begin with?
So a periodontist is someone that specializes in treatment of gum disease and dental implant placement.
Okay.
So, you know, it's not like you go to the periodontist for a normal thing unless you're having some history with periodontitis or gum disease.
Okay. And of course, that's a referral base from your local dentist.
Right.
Okay. Now, when we talk about the services, you were saying a periodontist does gum disease and implants. Let's break that down a little bit, shall we?
Okay.
All right. So when it starts with a single implant, what is that?
Okay. So that's the most simple implant procedure.
Okay.
As far as dental implants go. Single dental implants, if you have one tooth that's no longer fixable and has to be removed.
Okay.
And so that single tooth is replaced with a single dental implant and a crown, or a single tooth that's placed on top of it. So it functions just like your natural tooth would have functioned.
How do we get to that? What is the reason that we need a tooth extracted and an implant done?
So there can be many different reasons for that. Sometimes people are born without permanent teeth. So it may be something that's congenital.
Okay.
Just from birth. Then also other reasons, like, you know, all of us have things in the past that we've not done as well as we could have.
Of course.
We lose teeth because of different circumstances, whether it's
lifestyle.
Exactly. Different things like that.
Car accident, falling off your push bike, in Kentucky, falling off a horse. Do you know what I mean? There are many reasons.
Here,
okay, I was going to say, it's perfect for you being in Georgetown.
Kicked by a horse is real common.
Okay, now let's talk about dental implants. Now, there's long gone are the days with dentures. Explain to everyone what a denture is, and there's different forms.
A traditional denture is where all the teeth are gone and replaced with a removable device. That's a substitute for teeth.
Okay.
It's plastic. So there's ways to modify that to make it more stable.
Oh, really?
Yes. So dental implants can actually act as anchors or support to hold a denture in place.
Okay, so are long gone the days that you would remove everyone's teeth, all of the teeth in someone's mouth, and then do a denture? Are you doing those sort of treatments nowadays?
People still have to do that, you know, depending upon their background and things like that. But there are options now to make at least dentures to be a little more palatable.
Dr. King, implants can be expensive. Do all insurances cover?
They can be expensive.
Okay.
And plans are changing to cover more implant options because it is a good long-term option.
All right.
So most traditional insurance companies do cover implants.
And there's also other financial options out there as well that you can find out from people like you as well. Well, we appreciate everything you've just told us. We look forward to more interviews with you on the oncoming months. If you want to find out more information about Dr. King, it is all up on your screen. There it all is. Name, phone number and website. Give them a call. But of course, you do need to see your dentist first for a referral. We'll be right back after this short break, everyone.